NCLEX RN trainer with NCLEX RN tips. In this video, I am going to discuss compartment syndrome and questions which is related with compartment syndrome. We'll see what is compartment syndrome. See, compartment syndrome is a condition in which intercompartment pressure within a particular anatomical space is increased. As a result of that, the vascularity towards that tissues over that space is reduced. I repeat, there are two main things that you need to remember. One is intercompartment pressure within the tissues that are already increased, and as a result of that, the vascularity is reduced. I repeat, intercompartment pressure increases as well as the vascularity or the oxygenated blood supply is reduced. It happened within the compartment. Now you may think why this is considered as a compartmental pressure or why this is considered as a compartment syndrome. Okay, because within our body the tissues are usually arranged in a compartment wise, and we normally consider that area as a compartment. So compartmental pressure increases with multiple reasons. It can be because of swelling, it can be because of some kind of inflammatory changes. Okay, there are multiple reasons why compartmental pressure is increased that definitely we will discuss. So there are a number of reasons for developing compartment syndrome. I can list some of the causes which is really important for your exam. Fracture, burns, trauma, severe tissue trauma can be because of accident, or tight cast and infiltration of cytotoxic medications. Okay, remember all these causes. Because of all these causes, basically what happens, it increases the swelling within the anatomical compartmental space. Okay, so when the anatomical compartmental space gets swollen, so definitely what happens, the pressure within that area increases. Okay, so we said like when the pressure increases in the compartment, it will give pressure to the blood vessels as well as neurons. As a result, when the blood vessels get constricted, we said like necrosis can happen. So in compartment syndrome, we can see discoloration, or when you assess the area, it will be like a pale or dark in color, and vascularity is reduced so that when you touch, it will be cool to touch. Sensation is reduced, sometimes paresthesia is expected, and because of ischemic changes, there will be severe radiating kind of pain. Fine. And inflammation of cells can cause swelling. So, in compartment syndrome, you can see swelling, you can see paresthesia, discoloration, cool to touch. Fine. And there will be radiating kind of pain. So, these are the signs and symptoms usually found in compartment syndrome. So, when you notice any of these signs and symptoms among those patients, already I have mentioned the causes, infiltrated cytotoxic medication, or in case of cast application, or in case of fracture. So, when you notice any of these signs, immediately you have to inform the healthcare provider. Why this is important? There are two kinds of compartment syndrome, acute compartment syndrome as well as chronic compartment syndrome. So, in case of a traumatic injury or severe tissue damage can cause acute compartment syndrome, it requires immediate emergency care, but whereas in chronic it doesn't. Always prevention is better than cure, right? So, getting compartment syndrome and curing that is not really safe. So, we will try to prevent compartment syndrome, or we will assess the compartment syndrome as early as possible and try to prevent major complications. So, how do we prevent? Basically, when you take care of a patient with cast, it can considered as one of the reasons for getting compartment syndrome. So, you can elevate the casted extremities, as well as you have to closely observe the signs of compartment syndrome. It is really important. When you notice that, immediately notify the healthcare provider and cut the cast. So, when you take care of a patient who has cast in the place, please remember signs of compartment syndrome and always assess. Fine, that is one thing. And second thing, in case of fracture, always swelling can cause a problem, right? So we have to take measures to reduce swelling. So while taking care of a patient with a fracture, you need to take certain measures to reduce swelling by applying cold application, as well as you have to slightly elevate the affected extremities to promote venous return. Okay, so in fracture as well as in cast, you can prevent getting compartment syndrome. And third one we said like infiltration of cytotoxic medication can also causes the problem, right? So infiltration of cytotoxic medication. So remember, whenever you handle a medicine which is cytotoxic, that means chemotherapeutic medications, always remember never infiltrate the medicines, or always you need to administer the medications or these kind of cytotoxic medication in the fresh line, or you have to check the backflow before administering medication. Okay, never ever put the patient in a risk. Fine. Unfortunately, if patient develops compartment syndrome, you have to treat. Fine. So symptomatic management is really important. You have to reduce the pain of the patient, you have to reduce the swelling of the patient, you need to give psychological support for the patient, and the surgical correction is fasciotomy. Fascia is non-elastic layer which is covering the bone and tissues, and because the fascia is not having elasticity, that is considered as one of the basic reason why intercompartment pressure increases. So make a cut in the fascia so that the pressure can be relieved. Fine. And surgical excision of the necrotized tissue can also be performed in compartment syndrome. Let me focus what are the important questions which is frequently asked from compartment syndrome. Number one, what is compartment syndrome definition? Second one, what are the causes for getting compartment syndrome? That is something really important. And signs and symptoms of compartment syndrome. Definitely you will get questions like when a patient who is admitted with fracture and the patient is on cast, after 3 days of cast application, patient developed some kind of signs which is suggestive of compartment syndrome. These kind of questions will be asked. So causes relating with signs and symptoms, that is really an important thing. And how do we prevent is really an important question. So prevention of compartment syndrome is the next important point. Fine. And surgical correction for compartment syndrome. So when you learn compartment syndrome, focus what is compartment syndrome and what are the causes for compartment syndrome, signs and symptoms, important signs and symptoms, and preventive measures, and the last is surgical correction for compartment syndrome. This is all about compartment syndrome. I hope everyone got this point. Please make a note and please try to learn, and all the best for your exam. Thank you for watching. God bless you all.